So good morning, it's Classic FM 97.3, and in respect of the World Diabetes Day, we would be speaking with Dr. Abuchi Okaro, and you might be wondering who he is. He's a consultant general and laparoscopic surgeon. His special interests are in upper gastrointestinal oncology and bariatric surgery. His NHS practice is at the Kent Oncology Centre in Maidstone, Kent. He has a weekly private clinic at the Hospital of St. John and St. Elizabeth. Abuchi was trained in the UK and in Tokyo, Japan. Good morning, Dr. Okaro. How are you doing today?
Very well. Thank you very much. Good morning.
So I hope you're enjoying your stay in Nigeria at the moment.
As always. Always I do. Yes, thank you.
Okay. So we're going to be talking about the role of surgery in treatment of diabetes. And first, we just want to understand what is the state of diabetes in Nigeria and what is the best way of diagnosis?
Well, I think key questions, of course, the state of diabetes in Nigeria. I think that in reality, we don't know the state of diabetes in Nigeria in terms of the incidence. But there is some WHO data that does suggest that we're looking at about a 5 to 10% population incidence in terms of diabetes.
That's quite interesting. So there are two types of diabetes. You have the type 1 and the type 2 diabetes. So could you explain both and tell us which is more dangerous?
Yes, indeed, there are two types. There's a type 1, which is the one that people tend to get born with, and type 2 is the one that you acquire. So one's inherited, one tends to be stroke genetic, the other one is indeed acquired. Now, I wouldn't really put them in terms of danger. I think because that gives, that doesn't kind of represent the problem really. I think they both ultimately end up with the same problem, which is that the blood sugar levels in the blood, which is a byproduct of the food we eat, regardless of whether it is a carbohydrate meal or a fat meal or protein meal, will end up having to be broken down into the actual energy, the fuel that the body uses to get on with the job of doing breathing, moving around, and so on, is glucose, sugar.
So basically, what exactly is the cause of diabetes?
Well, basically, diabetes is where the sugar, the glucose that is circulating in the blood, is unable to get into the cell. It can't be used. It's not, underutilized. This is why the old term, if you remember, starvation in the midst of plenty, comes in. You've got a lot of sugar going around in the blood, but it can't get into the cell.
Oh.
Into the cell.
So it's building up just in the bloodstream. It's just building up in the bloodstream.
Correct. And then that's why you get high blood sugars. It goes out and spills into the urine and so on. But you see, the problem, apart from the fact that the cells are being starved, so the body's getting little energy, but there's a lot of sugar floating around. Some of the problems that come from diabetes are related to the way the body responds to high blood sugar levels, what we call the sort of macrovascular or microvascular. Basically, it damages every organ. It damages the kidneys and can give you kind of renal failure. It damages the nervous system and gives you what we call neuropathy. It damages the eyes and can lead to some degree of cataracts, and of course, in some cases, it can cause blindness and impaired visual ability. It damages the blood vessels and causes hypertension. It is responsible for things like heart attacks. It can lead to sleep problems and sleep apnea. So I mean, it's so central. It is so central. And that's why diabetes is a more or less a global problem in terms of the body's systems.
So do people actually need to be worried if there's some sort of history of diabetes in the family?
I think yes, indeed. It's always an indicator. It's always a kind of a warning potentially that you can be more prone to get diabetes if you have a family history of diabetes. And of course, we're focusing a lot of this discussion, I must say, on type 2 diabetes, which is the diabetes that you acquire as you get older. And this type 2 diabetes is indeed the more common of all the diabetes anyway. And I think we must make that very clear.
So some sort it's preventable, because when you say it's acquired, you could prevent it. Is it preventable?
It is. And I think that is a very important comment, really. I think that is one of the messages I think that we should be looking at, emphasizing on this, important day, the World Diabetes Day. The diabetes type 2 in large, large respects is preventable. And you're talking about watching what you eat. You're talking about the amount of calories that you consume. You're talking about the amount of exercise and activity that you do in order to burn the fuel that is in the blood circulating around. You're talking about being obviously keeping your weight well balanced and quite low, which is obviously some important parts of the discussion regarding type 2 diabetes and weight control.
So why is there a misconception that women are more prone to diabetes? Is this true?
Good question. I've never heard of that, actually, but I think that's why it's probably called a misconception. Yes. But no, I don't think. I'm not sure there can be any genetic. Because I mean, what you say, women are more prone. You're actually not talking. There's a genetic predisposition, and I think that's not true. But what I could probably agree, or I suppose suggest, is that historically women have always been more concerned and more in tune with their bodies. They tend to find or feel there's a problem. They go and see the doctor. Now, historically, men don't do that. So I suspect it might be more presentation than actual incidents, I suspect.
Sometimes it's been said that people with diabetes often experience what you call hypoglycemia. Is that true?
Yes, I mean, you can experience hypoglycemia with diabetes, and that is true. But I mean, just to sort of define what that is, I mean, hypoglycemia is a state of low blood sugar.
Right.
Now, when you say low blood sugar, of course, that is truly a blood sugar that using the machine for checking it is low. Now, it's normally slightly a problem of poor sort of lifestyle and drug and nutritional compliance. For instance, if you are on sugar-lowering drugs like metformin or glycoside, or and you are taking a full dose but not eating your meals regularly, or you're skipping a meal because you're too busy in the office, or so, and then yes, I think you can be at risk of having a low blood sugar or hypoglycemic crisis. So yes, I think that it's quite dangerous, as you know. For some very rare occasions, it can lead to sort of unconsciousness and coma.
Okay, so the most important thing is, okay, go on. Yeah, go on.
Yes, no, I mean, you're right. I mean, so that's something we need to watch out for. And all diabetics, quite frankly, are very in tune to low blood sugar. And in fact, they're more worried about low blood sugar than high blood sugar, in all fairness.
As a result of the drug that is being taken?
Indeed, to a large degree, yes. So if you take a drug that maybe lasts in your system for 12 hours, you have your breakfast, for instance, and then you should have your lunch at an appropriate time, and you skip your meal, or you're not having an adequate volume of nutrition or so on, then there's a possibility that you may get a low blood sugar state, yes.
So it's all about exercising caution and care in the course of your medication.
Indeed, lifestyle, and obviously sort of a compliance with drugs and meal patterns and habit and so on.
So can diabetes be cured?
Well, that's a really, really important question. I think that the world has been asking, and I think scientists and researchers have been spending a lot of time looking into. I think, to be honest, I think we can be pretty confident these days now, but we can be bold enough to say that to a degree, yes, we can cure diabetes. Now, I will probably add in a little caveat to say, just to be fair to the research, that the cure may well be temporary, but there are occasions where the cure is is long term. And maybe we shouldn't use cure. I think with a chronic condition like diabetes, it may be reasonable to use remission.
Okay.
Or resolution.
So where does,
because I think cure always gives the impression that it's something, we look at cure with normally sort of treatments for, let's say, malignant tumors. We talk of cure. I think remission or resolution is probably a term that I would always like to use. Can we take diabetes into full remission or full resolution without the use of drugs in a type 2 diabetic patient?
Where does surgery come in here?
That's important.
Where does surgery come in?
Well, I think it's on the back of what we've just said. It's really on the back of that. So a patient says, look, comes to see his doctor, a very informed patient, male or female. Look, I've been on these diabetic drugs for quite some time. I'm getting a little bit tired. Is there anything I can do that will mean I can actually probably come off my drugs or reduce the quantities or amounts of my drugs and still not put my body or my life at risk by running a high blood sugar continuously? And the answer is now yes. There are things that can be done. The world of surgery that had to do or does specifically done to make people lose weight, what we would obviously call bariatric surgery, started a long time ago. It's surgery that we use to make people lose weight. Now, they just happen to stumble across, in a way, some of the findings within that actually the patients who have this surgery who end up losing weight actually get their blood sugars improved, and some of them who were diabetic stop becoming diabetic.
Oh, really?
So it came along and people said, oh, this is an interesting observation. And eventually it became very clear that actually when you do procedures or operations, on the gastrointestinal tract, it's like the stomach, the small intestine, for instance, that you can actually end up with more or less a full and complete resolution of diabetes. And this really was interesting. I mean, this is a problem that people have been trying to solve for a long time. So yeah, it attracted a lot of attention. It then went into research. Of course, they had to prove it scientifically. So we conducted, quite a lot of research studies, both in the laboratory.
So, doctor, how risky is this surgery actually? What's the percentage of risk with this surgery?
As you know, risk is always something that you must take and answer in the context of benefits, because of course that risk benefit equation is a very important equation. But I think overall it's very safe. These days it's safe.
How affordable is it?
Affordability again has to be taken in to the context of obviously the gains. I would consider it affordable. We have done studies. I think there was a Swedish obesity study called the SOS study that was performed as a randomized control study, which basically means they followed these patients after surgery for a prolonged period, I think 20 years or 25, and they actually proved that it's actually financially viable. So basically, the treatment of diabetes and diabetes-related complications compared to having an operation as a one-off.
All right, doctors.
It was cheaper to have the surgery.
Dr. Time will not permit us to go on and on and on, but it's quite an interesting topic this morning. So how does anybody interested reach you? How can they reach you?
We have a metabolic and diabetes center that we offer here, treatments for here and in Lagos. So I mean, we're based at Euracare multi-specialist hospital in Eunice Bashall Street in Victoria Island. So yes, we patients are more than welcome. We offer consultations, of course, and treatments are all done, yes, in our center here in Lagos.
Thank you very much, Doctor, for coming on the show this morning. And if you're just listening, it's Classic FM 97.3. We've been speaking with Dr. Abuchi Okaro. He's a consultant general laparoscopic surgeon, and his special interests are in upper gastrointestinal oncology and bariatric surgery. Thank you very much.
Thank you very much for having us. Thank you.